Hi, welcome to Lactation with Amy. In this video, we're going to go through 6 common breastfeeding positions for you and your baby. Not only are we going to go through what these positions are, how to set it up, I'm also going to talk about what I think are benefits and challenges with these positions and give you extra tips to make sure that these positions are nice and comfortable for you and your baby when you're trying it. So if you're interested, please keep on watching. Cradle hold, like the name suggests, you're basically cradling and hugging baby close to your body next to your breast for them to be able to breastfeed. The benefit for this position, in my opinion, is that it can make you feel close to baby, like you're giving baby a big hug. It is also a natural position and it's usually a widely accepted position. So for example, if you see moms breastfeeding in a cafe, that's usually the position they breastfeed in. They could put a little wrap around their chest and baby for more privacy as well. It is a position that works for most breast sizes and most baby sizes, so I think that's what makes it a really popular position. The challenge for this position is that sometimes moms can get sore shoulders from holding baby, so my number 1 tip would be trying to latch baby and making yourself comfortable first, and then stacking pillows under your elbow to help your muscles relax and make it more comfortable for you. Another tip to make it more comfortable is to put a mirror in front of you to see how well baby is positioned, because we're looking for a straight spine and for baby's head, shoulder, and hip to face the same direction to make sure that it is comfortable for your nipple. Number 2, cross cradle hold. The cross cradle hold is quite similar to the cradle hold, where in the cradle hold, moms are usually supporting baby with the right arm when they're feeding on the right breast. With the cross cradle hold, that's when moms support baby with the left hand when feeding on the right breast and vice versa. In this position, moms can feel more in control. This position can be ideal for sleepy babies or premature babies when they lack that neck support, when they tend to be sleepier, more relaxed, so that we're supporting babies and baby's neck and giving them some guidance when they're exploring to breastfeed. Some women find that it's easier to shape and hold baby, as you can use one hand to support baby and one hand to shape your breast. A challenge for this position is that mothers usually tend to hold onto baby's head and feel like we're more in control of baby. Usually when we're feeding baby, they have a lot of complex nerves that sit around their head. So holding onto their head will interfere with their feeding reflexes. So instead of grabbing onto the head, we want to support baby with our hand on their neck and their shoulder to keep them close to us. Because this position tends to be used for babies who are quite sleepy or taking a longer time to be able to latch onto the breast, some women experience pain, and that's partially associated with not waiting for that open gape before bringing baby to you. So if you are feeding in the cross cradle position, just be patient, hold baby's neck and shoulder, allow baby time to show their feeding reflexes, orientate themselves, and then bring baby close to you when they indicate that they're ready to latch onto the breast. This position can also be quite uncomfortable if you're grabbing baby with one arm for long periods of time. So a lot of the time we recommend that if you find it easier to latch baby in the cross cradle position, to do that first, and once baby's comfortably latched on, for you to bring your arm around and swap into the cradle hold. A tip is that some women find it easier to do a cradle position on one side and then do a cross cradle on the other side, especially if they find that one of their arm is a lot more dominant than the other arm. Another tip when you're doing this position is to give baby lots of time for them to look around, lick, bring their hands to you, and then open their mouth, lick around, stick their tongue out, and then have that open gape. So there's usually a series of things baby will do to indicate that they're ready to latch onto the breast before they have that open gape. So a little bit of patience goes a long way when you're doing this position. Number 3, football hold and variations. A football hold is similar to how you would imagine you're kind of holding onto the football under your arm, which is how we would support baby when you're feeding in that football position. Women with pendulous breasts and larger breasts and excessive breast tissues usually find this position quite comfortable because the nipples usually sit lower, and it's harder for women to visualize this in the cradle position. They might find the football hold allows them to see their nipples a lot better and to be able to look for baby's open gape and then latch baby onto the breast. Depending on how you set it up, you are able to relieve your shoulders and fully relax when you're feeding in this position. It can also make you feel more secure. So this is a great position if you've had a C-section and you're experiencing lots of surgical wound pain. It is also a good position for preterm baby, as we can guide their neck and shoulder. It's also the most common position women do when breastfeeding tweens. A lot of women also report that this position hasn't worked for them and that they find it really unnatural. Personally, I find that once you know how to set up the football position properly, it can make it a lot easier. Which brings to my tips. When you're doing the football position, we have to shuffle baby all the way back where the nose is lining up with the nipple and making sure that baby is not too far forward, especially if your baby is long, so that baby is hunched over having to reach your nipple. If your baby is quite long and baby has no more space to shuffle back because of the sofa or the chair that's in the way, then you can stack pillows behind yourself so that there's more space for baby's legs to go. And if baby is still too long, then we can start angling baby's body lower and lower so that baby is in the reclined position in the football hold. The football position may not work as well for older babies, especially once they start walking, crawling, less likely to stay still and want to start exploring with their little eyes and their hands and their feet while they're breastfeeding. Number 4, laid back position. Women often do the laid back, reclined and breastfeeding position for their first feed after birth, and it is a position that allows you to rest and for baby's body to rest on your body. It also encourages baby-led attachment, which allows baby to show their natural feeding cues and slowly find the breast and start breastfeeding. Some challenges when we're doing a laid back position is that it may not work if the baby is really uninterested and sleepy and needs additional support with breathing when the baby has low tone. Usually they are not physically well enough to show us these feeding cues and to demand to feed. So if that's the case, then the other positions might work better to keep baby awake and encourage them to show these feeding cues to feed. A key tip for this position is to start baby in the center of your chest, tummy to tummy, with baby's skin touching your skin to really allow them to show their natural feeding cues and their natural feeding instincts. Number 5, side lying position. I gotta say that the side lying position is one of my favorite positions to help women set up because it can be so comfortable for women, allow them to rest, and it is also the safest position to breastfeeding if you feel like you might fall asleep. A lot of women find it awkward to hold baby and feel like they need like 8 arms to be able to secure baby when they're breastfeeding a newborn. So the side lying position kind of temporarily removes those problems because the bed is what's supporting baby and all you have to do is to put your hand on baby for a little cuddle. This is also a great position for women with perineal trauma, as they might find it uncomfortable and painful to sit upright in the early days postpartum. A challenge for this position is that you might need a support person to bring your baby to you, with you lying on your side and baby lying on the side to set it up properly for it to work. This position may not work well for mothers who are still recovering from a C-section wound, as they often find it harder to lie on their side with no wound pain. However, as soon as you feel comfortable side lying and resting in that position after a C-section, then you can start trialing this position and see how it works for you. A key tip for this position is to line the baby's nose to nipple and make sure baby is not too high on the bed close to your armpit. Baby needs to be tummy to tummy facing mom in this position. Another key tip is that if you think you might fall asleep in this position, we still want to apply the same safe sleeping measurements to make sure that we're doing it in the safest way possible for your baby. So when you're doing this position, we're going to do it on a firm flat mattress, completely flat and not reclined. We don't want you to do this position on a soft sofa. You want to leave enough space so that baby isn't going to roll off of the bed. If you are using blankets to keep yourself warm, we recommend you to keep your blanket below waist level so that nothing can touch baby and be close to baby, for the sake of safe sleeping. If baby is swaddled, we want you to unswaddle baby, let the arms out, remove the swaddle, and have baby dressed in layers of clothes with no loose fabric potentially going over baby's face. So this is the safest way for you to do the side lying position if you feel like you might fall asleep. Number 6, the straddle hold. The benefits of the straddle hold is that it can be great for babies who have trouble opening wide and having that wide gape to be able to latch onto the breast. As baby is more likely to be upright in the straddle position, the gravity can sometimes help relax the chin. This also applies for babies who have poor tone, so babies with receding jaws and trisomy 21 babies tend to need additional support for chin control when they're trying to breastfeed. So the straddle hold position combined with butterfly fingers can help increase baby's tone and assist baby to be able to latch deeply, form a stronger vacuum when breastfeeding. This position can also keep them more active if they tend to be too sleepy to breastfeed. This is also a great breastfeeding position for bigger babies or toddlers. When they can sit upright and have that head and neck control, then It is a really convenient position because you can just be anywhere and baby can rest on your leg or the sofa next to you and be able to feed on demand and look around and explore while they're feeding and holding something in their other hand. The challenges for this position is that it may not work if your newborn is really active and tends to cry when they're feeding. If baby's already quite active and crying when trying to feed, then this may not be the best position to try during that time. This position can also be a little bit hard to set up without additional support, especially in the newborn state, and you may need an extra hand when setting up this position. A tip for you to get to this straddle hold position is to try the laid back position first with you reclined and baby lying along your body. And once baby is latched down, you can try to transition by just supporting baby, keeping baby close to you, and see if we can use pillows to help baby get into that upright straddle position. I hope this video is helpful to you because often I feel that one breastfeeding position will work with the newborn on one feed and then it stops working the next feed. So it's always good to know that you can do other positions and that you have other positions up your sleeve for different feeding situations. That wraps up my video of 6 common breastfeeding positions. I hope you give one of them a try if you haven't tried it before, and put it down in the comments below to let me know how you went. Good luck and all the best. If you would like to see more content about breastfeeding, newborn care, transition to motherhood, I will be releasing new videos every fortnight for the rest of this year, so please subscribe and comment down below what content you would like to see. Bye!